Nebraska is set to make a significant change to its food assistance program. Starting January 1, 2026, the state will ban the purchase of soda and energy drinks using SNAP benefits. This two-year pilot program aims to assess the impact of this restriction on recipients and their purchasing habits. This move positions Nebraska at the forefront of a long-standing debate about permissible foods under SNAP. The U.S. Department of Agriculture has granted Nebraska a special waiver. This waiver allows the state to exclude sugar-sweetened beverages like soda and highly caffeinated energy drinks. This federal approval is a critical component, as SNAP is a federally funded program with national standards. It is the first time in the history of SNAP that the USDA has authorized a state to implement such a specific exclusion. Nebraska's success in obtaining this waiver signals a potential shift in federal thinking. It opens the door for other states to consider similar modifications to their own SNAP programs. The debate over restricting junk food purchases with SNAP benefits is not new. Policymakers, public health advocates, and anti-hunger organizations have long grappled with this issue. Concerns about nutritional quality often clash with arguments for recipient autonomy and potential administrative complexities. Previous administrations have consistently rejected state requests for waivers to restrict unhealthy items. Nebraska's bold move, therefore, comes after a long period of policy inertia on this particular front. Proponents of Nebraska's new policy argue that taxpayer money should be directed towards purchasing nutritious foods. Governor Jim Pillen emphasized that the program should support health and well-being, not subsidize purchases that may contribute to poor health outcomes. Soda and energy drinks are often high in added sugars and calories, offering little to no nutritional value. Health experts link excessive consumption of sugary drinks to chronic health conditions like obesity, type 2 diabetes, heart disease, and dental problems. Energy drinks also present concerns due to their high caffeine content and other stimulants. The USDA's approval of the waiver is framed within a broader federal initiative to make America healthy again. By allowing Nebraska to test this restriction, the USDA is exploring policy levers that could encourage healthier dietary patterns. The hope is that such measures might contribute to a healthier populace and potentially reduce long-term healthcare expenditures. Some proponents believe this policy will nudge SNAP recipients towards making healthier food choices. While it restricts certain items, the core benefit amount remains unchanged. Recipients can still purchase the same total value of food. By removing the option to buy soda and energy drinks with SNAP funds, individuals might opt for healthier alternatives like milk, water, or 100% juice. This subtle shift in purchasing patterns could contribute to improved dietary quality over time. The new policy in Nebraska will directly impact a significant number of its residents. Approximately 152,000 to 155,000 Nebraskans are enrolled in the SNAP program. This figure represents about 8% of the state's total population. These individuals and families rely on SNAP benefits to supplement their monthly food budgets. The ban on using these benefits for soda and energy drinks will necessitate adjustments in their shopping routines. For these recipients, the change means that these specific beverage categories will no longer be eligible purchases when using their SNAP EBT cards. The demographic makeup of SNAP recipients is diverse, including families with young children, elderly individuals, and people with disabilities. The policy change will affect all these groups, requiring them to navigate the new restrictions. Those who regularly bought soda or energy drinks using their SNAP benefits will now face a choice. They can either forego these beverages, purchase them using their own non-SNAP funds, or seek out alternative drinks that are still SNAP eligible. The overall effect on household food security will be a key aspect to monitor during the pilot program. Proponents of Nebraska's initiative advocate for nutritional integrity within the SNAP program. They argue that public funds should support the purchase of foods that contribute positively to health and nutrition. The ban is presented as a corrective measure to align SNAP spending with public health objectives. Supporters argue that the SNAP program already involves certain limitations, like no alcohol or tobacco. Extending these limitations to include products widely recognized as detrimental to health is seen as a logical step. The goal is to ensure that the assistance provided encourages a baseline of nutritional quality, leading to better health outcomes for recipients. This could lead to a healthier population and potentially reduce the burden of healthcare costs associated with poor nutrition in the long run. Despite the arguments in favor, Nebraska's new SNAP policy has drawn considerable criticism. Opponents, including groups like Nebraska Appleseed and FRAC, argue that such restrictions stigmatize SNAP recipients. They contend that singling out specific items for ban implies that low-income individuals are incapable of making responsible food choices. Critics also raise concerns about restricting personal choice and autonomy. They believe that individuals should have the freedom to decide what foods and beverages they purchase. Some nutritional sciences experts worry about potential unintended negative health or social impacts. They suggest that such a ban might not necessarily lead to healthier diets and could cause stress for families. Many opponents advocate for alternative approaches, like incentive-based programs, to improve nutrition among SNAP recipients. Examples include double-up food bucks initiatives, which have shown success in increasing healthy food consumption without imposing bans. To understand the context of Nebraska's policy, it is helpful to look at data regarding SNAP spending. A USDA study found that soft drinks were the largest single expenditure category for SNAP households, accounting for approximately 5.4% of their total food spending. This finding is often cited by proponents of restrictions as evidence that SNAP funds are being used for sugary, non-nutritious beverages. In Nebraska, around 155,000 individuals, or roughly 8% of all Nebraskans, receive SNAP benefits. The reach of the program means that policy decisions like the soda and energy drink ban are significant interventions in the food security landscape of the state. Nationally, the SNAP program is even more extensive, serving millions of Americans each month. While Nebraska's policy is currently a state-level pilot, the underlying issues and debates are relevant across the country. National SNAP statistics show that the program plays a vital role in alleviating hunger and poverty. The average benefit per person helps to bridge the gap between what a low-income household can afford and the cost of a basic, nutritionally adequate diet. Any widespread adoption of policies similar to Nebraska's could have far-reaching consequences for public health and food purchasing patterns nationwide. Nebraska's ban on using SNAP benefits for soda and energy drinks is structured as a 2-year pilot program. This experimental period allows the state to gather data and observe the real-world effects of the policy. The program is scheduled to begin on January 1, 2026, and its outcomes will be closely monitored. Nebraska's Department of Health and Human Services will be tasked with designing and implementing an evaluation plan. This plan will likely measure changes in the purchasing patterns of SNAP recipients and assess any shifts in attitudes towards healthy eating. Evaluating the true impact of such a targeted intervention presents several challenges. It can be difficult to isolate the effects of the soda and energy drink ban from other contemporaneous factors. Despite these challenges, the findings from Nebraska's pilot program will carry considerable weight. If the program is deemed successful, it could provide a model for other states. Conversely, if the evaluation reveals significant negative consequences, it could discourage similar initiatives elsewhere. The rigorous and transparent evaluation of the pilot program is exceptionally important for future food policy discussions. Nebraska's move to restrict soda and energy drink purchases with SNAP benefits is not occurring in a vacuum. Several other states have expressed interest in implementing similar restrictions. States such as Iowa and Arkansas have requested waivers from the USDA to enact their own limitations on SNAP-eligible items. Texas recently passed a bill aimed at banning the purchase of items like chips and candy with SNAP benefits. This pattern suggests a broader trend among certain state governments to align SNAP more closely with specific health and nutritional goals. The outcome of Nebraska's 2-year pilot program will be a critical factor for these other states. If Nebraska can demonstrate positive changes in purchasing habits and better health indicators, it could embolden other states to push for their own waivers. Conversely, if the program encounters major problems, it might serve as a cautionary tale. The willingness of the USDA under Secretary Brooke Rollins to grant Nebraska this historic waiver signals a potential openness to state-led experimentation. The differing philosophies regarding the role of government in influencing food choices are central to these state-level debates and initiatives. The debate surrounding what SNAP benefits should and should not cover has a long and contentious history. For decades, proposals to restrict the purchase of junk food or sugary drinks have faced strong opposition. Previous federal administrations have typically rejected state requests for waivers to impose such restrictions. Nebraska's successful attainment of a waiver from the USDA marks a potentially pivotal moment. This decision suggests a greater willingness at the federal level to consider state-led initiatives aimed at influencing the nutritional quality of foods purchased with SNAP benefits. The long-term implications of Nebraska's experiment are substantial. If successful, it could fundamentally alter the landscape of food assistance in the United States. The SNAP program might evolve to actively promote healthier food choices. Nebraska's bold move has opened a new chapter in the ongoing conversation about the program's purpose and future direction. The results of this 2-year pilot program will be crucial in shaping future policy decisions, not just in Nebraska, but potentially across the nation.